Dr. Nikki Florence, thank you for joining us today with the Illinois Channel. We are here this evening to discuss the issues pertaining to fitness after a certain point in life. Would you be able to explain to us some of the key points that you're going to discuss with people tonight?
Absolutely. Well, what we do know is as we age, things change. Our metabolism slows down. Unfortunately, we might start to gain weight or have other changes medically that might affect our health overall. So we are here talking about all those components that are so important to maintain a healthier life. Talking about activity and exercise, talking about nutrition, as well as even hydration and water intake. That is so important for us as we get older.
What aspects of nutrition would you say are very important components to fitness?
Well, what's interesting is as we get older, we know our metabolism slows down. It actually slows down by 10% for every decade over 40. So our needs change. We don't need perhaps as many calories. But on the same side, if we're trying to build muscle and become more fit, we need to make sure we're getting enough protein. So there's always a balance of, not only eating the right things, but are we eating them frequently, making sure we're not meal skipping. There's a lot of things involved to make sure you're doing it the right way.
What other aspects would you say that people are the most concerned about when they are beginning to initiate their fitness program?
Well, you always want to make sure that your medical issues are stable. We always want to make sure we're going to make things better, not make things worse. So there can always be a barrier such as arthritis pain. There are times that maybe your diabetes may be a little out of control. So our hope is to put all those components together and see how we can improve those things for folks. We know that if we can make you healthier now, give you healthier habits, that's going to grow into you being more healthy in your 50s, your 60s, your 70s. And imagine if we have a healthier population overall, the impact that will have on healthcare as a whole.
What are the most commonly asked questions by this population to you?
Well, of course, the first thing is, how do I get started? I think there's a lot of resources, a lot of information out there, so you always want to know what's right for you. And we always want to make sure that we meet people where they are. I never tell somebody, I want you to exercise an hour and a half a day, 7 days a week, when you haven't done anything. So how do we gradually do what is necessary to get you to your goal? So those are some of the things we'll talk about.
Also joining us this evening is Dr. David Sandercock, also of Memorial Physician Services. Dr. Sandercock, what would you say are some of the main components that you would like to address this evening?
One of the things that I'll be talking about this evening is metabolism and how metabolism affects our ability to be healthy. This talk is a nice segue into the program that Sports Care is putting on through the generous help of the YMCA and Memorial Medical Center. But I think probably the biggest take-home message that I would like for people to have is that in all of this, planning is probably the most crucial aspect. I think if people don't sit down and plan how they're going to make the changes that they want to make, none of the changes happen.
What would you say are the most commonly discussed hesitations with the population in implementing a new fitness program?
I think the biggest thing that people complain about is time. Nobody has enough time to do the things that either they know they should do or that we would like for them to do. And absolutely time is a barrier for all of us, but then, as I mentioned, it gets back to planning. If I really want to do this, how am I going to plan my day so that I have that time? And that involves prioritizing. If I am a priority and these changes are really important to me, I have to figure out how to get it done.
What else would you like to discuss with the population who is beginning to implement a fitness program over the age of 40 or so, or even later in life in their 50s or 60s?
I think A would be that it is doable. All of us can do it. And B would be that I think the best way to go about this is through slow, steady change. I think if you try to jump into things feet first, ultimately, for some reason, you will stop. And if you can do things on a slow, incremental basis, you're more apt to be able to repeat those things over and over again and therefore be successful.
Taking on this type of prospect can be daunting for some. Is it more a matter of simply working out or nutrition, or is it a combination of both that can help?
I think that's a great question. I think it's a combination. Most people would probably admit that they eat some things that they could probably do without, and I think healthier eating habits absolutely are the biggest part of this process. If you're not putting in healthy things that your body can use, it will be near impossible to lose weight. And the second part of it is the activity part. So we talk about exercise, and the hard thing that we have to try to manage in our practices is when we say the word exercise, are we going to scare people away? And so what we really want people to hear when we say the word exercise is activity. We want you to increase your activity. There are times in the day when you set aside maybe 30 minutes to exercise or be more active. I don't care if that's a brisk walk or if you can run or ride a bike or swim. But then during the day, can you find ways to be more active? Instead of using your remote control, can you get up and walk over and change the channel? When the commercial comes on TV, can I stand in place and walk instead of just sitting there? Can I take the stairs instead of the elevator? So I think you have to do both, but you don't have to kill yourself exercising to get your activity level in to the point where you're burning calories to lose weight.
Thank you for joining us.
Thank you.